Hi, I'm Tori. I'll be your student nurse today. I'm going to wash my hands, and then I'm going to close the curtain to provide privacy. Can you verify your name and your date of birth?
Brianna Slaughter, 3/11/95.
Okay, the patient appears to be their stated age. Do you have any allergies?
No.
Are you in any pain?
No.
Their speech and their mood and their dress appears to be appropriate for the situation. Can you tell me the day?
8/9/2015.
Where are you at?
Detroit Mercy.
And who's the president?
Obama.
And the patient is alert and oriented ×3. And I'm just going to palpate their hair. There doesn't appear to be any lesions or bumps, and there's no lice present. And their skin is warm and appropriate for their ethnicity. And can I have you puff out your cheeks? Smile. Now raise your eyebrows. Cranial nerve 5 and 7 are intact. And I'm just going to take a look at your eyes. Follow my pen light. Okay, pupils are parallel, round, reactive, and equal to light. Her face is symmetrical. There doesn't seem to be any facial drooping. Her nose is midline. And can I have you open your mouth for me? Do you have your tonsils? Okay, so the patient doesn't have their tonsils. She has all of her teeth. They are all white. There doesn't seem to be any dental caries. Her gums are pink and they don't seem to be receding. Her mucosa is pink and there doesn't seem to be any inflammation. And her tongue is pink as well. And I'm just going to palpate your carotid artery. And now I'm going to take a listen with the bell. And can I just have you hold your breath? Okay, there doesn't seem to be any bruise. And now I'm just going to take a listen to her heart sounds. This is the aortic, which is the first intercostal space on the right side. The pulmonic, which is the first intercostal space on the left side. The herbs, which is the third intercostal space on the left side. The tricuspid, which is the fourth intercostal space on the left side. And the mitral, which is the midclavicular line. And then I'm going to flip it over and listen to the mitral for a minute with the bell. I'm going to go back in the same order. Okay, now I'm just going to take a listen to your lung sounds. Can you breathe in deep for me? And can I have you stand up and turn around? Now raise your arms. Okay, you can sit back down. There doesn't appear to be any adventitious sounds or fluid in the lungs. And I'm just going to look at your upper extremities. The warm is skin, and the skin is warm and appears to be intact. And there's no lesions, and it's the color for the ethnicity. And now I'm going to grade the brachial pulses. +2 bilaterally, now the radial. +2 bilaterally, now I'm going to check the capillary refill. Less than 3 seconds, and there doesn't appear to be any clubbing, and the patient's hands are groomed and well kept. Now I'm going to have you squeeze my hand as tight as you can. Good. And the muscle strength is a 5+. And now I'm going to have you stand back up for me. And turn around and touch your toes. And their spine appears to be S-shaped. There's no abnormal curvatures. And can I have you stand back up? And let me know if you feel any tenderness, okay? You feel any tenderness? Okay, can I have you sit back down? Oh, and the anterior and posterior diameter is about equal. Okay, can I have you lean back for me? Now I'm just going to lift up your shirt. There is no scars or lesions, and the stomach is rounded. And I'm just going to take a listen to all the vowel sounds. Vowel sounds are present in all 4 quadrants, and now I'm just going to palpate. Let me know if you feel any tenderness, okay? Do you feel any tenderness? Okay, can I have you sit back up? The patient doesn't have any JVD. And in the right lower quadrant, we have part of the ascending colon, the appendix, and a right ovary. And in the right upper quadrant, we have part of the liver, the gallbladder, and a right kidney. And in the left upper quadrant, we have the left kidney, part of the stomach. And in the left lower quadrant, we also have a left ovary, part of the sigmoid colon, and part of the descending colon. And now I'm just going to take a look at her pulses. And her skin is warm and dry, and it's normal with the ethnicity. There's no lesions. And I'm going to check the popliteal pulse. +2 bilaterally, the tibial pulse. +2 bilaterally, and the pedis pulse. +2 bilaterally. And now I'm going to perform the Babinski test. She has a negative Babinski test. And can I have you stand up for me? And close your eyes and put your arms and legs together. Patient appears to be balanced. And can I have you sit back down? Now stand up for me and walk to the door and back. And the patient appears to have a normal gait. She doesn't favor one side over the other, and there's no limping. And the tympani, the stomach, the liver is dull, and the rest of her abdominal area is tympani sound.